Welcome back. Thank you for staying with us. This is KTN News and you're watching KTN Prime. We continue on with our coverage. Now, provision of health services is set to be paralyzed in 2 weeks' time if health workers' threat to down tools materializes. Now, health workers comprising of clinical officers, nurses, nutritionists and others have threatened to go on strike if both the national and county governments fail to honor their pending collective bargaining and recognition agreement. They accuse both the Ministry of Health and county governments of failing to harmonize working relationship with health workers. Gloria Milimo tells us more.
With only 2 weeks left to go before their 60 days ultimatum lapses, healthcare workers comprising of different cadres have threatened to withhold their services from next month, citing frustration over the implementation of their collective bargaining agreement with both tiers of the government. The health workers want their employer to address all the outstanding human resource challenges, among other issues raised in their CBA, including the employment of an additional staff to bridge the current deficit, failure to which they say Kenyans in need of health services should brace themselves for tougher days ahead.
Come 13th of next month, that we shall be going on strike, and to tell Kenyans that from the 14th day of July, across the Republic of Kenya, in any of the public health facilities, there is no healthcare worker who is going to be available to see them.
Jambo lile ambalo serikali iliweza kuahidi la kwanza ni kwamba wataajiri wahudumu wa afya 20,000. Hilo halijaweza kutekelezwa.
Similarly, they have faulted the national government for failing to honor the Abuja Declaration, in which Kenya is a signatory, that requires governments to allocate at least 15% of their budgets to health, saying the current allocation poses a threat to the realization of universal health coverage and general prioritization of health.
The budget has been reduced by 5.6 billion from last year's budget, though the projection was actually to take that budget upwards to the tune of 154 billion. And so we do not understand when the government on one side says that we want to even make health better by moving from universal health coverage to universal health care, but on the other side, they are reducing the budgetary allocation to health.
Weighing in on the recent proposal to increase the National Hospital Insurance Fund monthly contribution, the health workers say there is need for public participation to enable Kenyans scrutinize value for their contribution, given how the funds have been mismanaged in the recent past. For now, it remains to be seen whether the health workers will make good their threat should their demands remain unaddressed. Solidarity. Gloria Milimu, KTN News.
Moving